Your doctor has asked me to take a blood sample, to do a test for iron deficiency anemia.
What's iron deficiency anemia? Is that different from regular anemia?
There are quite a few different types of anemia, but your doctor wants to check for iron deficiency anemia because of your symptoms. Iron deficiency anemia is a blood condition which means that you don't have enough healthy red blood cells in your body. A type of protein in your blood cells called hemoglobin carries oxygen around the blood, so it can circulate to all your body tissues.
How did I get the deficiency?
There are two main reasons a person becomes iron deficient or anemic. The first is because of an increase in demand for iron in the body during a growth spurt, for instance during pregnancy. Alternatively, the body may need to replace lost iron during periods of heavy bleeding, such as after surgery or after heavy menstrual bleeding.
Well, I'm not pregnant and I haven't had any surgery lately, so that isn't right.
I mentioned that there are two main reasons for iron deficiency anemia. It can also be caused by a decreased iron intake or decreased absorption of iron in the body. The kind of iron that is easily taken into the body is called heme iron. That's the kind that is found in red meat and shellfish. Non-heme iron is not absorbed quite as well. That's the kind found in plants and supplements. As well as dietary considerations, there are some medications that can affect the way iron is absorbed in your body.
Oh, okay. That makes a bit more sense. I stopped eating meat a couple of months ago, and probably didn't do enough research about other sources of iron in my diet. I'm a bit worried about having a blood sample taken. I really don't like having it done, and I get very anxious when I think about it.
That's okay. Some people get a bit worried before they have a blood test. Sometimes it helps to explain why you think you may feel that way. Have you had a bad experience in the past?
Yes. When I was a lot younger I had to have a blood test. I tried to explain that I was nervous about it and worried it would hurt. The nurse just said I was being silly, and that it wouldn't hurt. That made me even more tense and of course, it did hurt.
I'm sorry to hear that you went through an experience like that. There are a few things that I can do to make the procedure easier for you. Firstly, it helps to have a friend or support person with you while I take the sample. If you are here on your own, I can call a colleague who'll sit with you.
Thanks. I came on my own today and didn't expect to have a blood test done.
The next thing is to use some numbing cream over the area I'll take the blood sample from. A lot of people find that is helpful.
That sounds good. No one offered me that before. Does that mean it won't hurt at all?
The numbing cream stops you feeling that first pinch as the needle goes in. I don't like to promise that taking blood doesn't hurt at all, because everyone experiences pain in a different way. What I can assure you is that I'll explain what I'm doing and you'll have my colleague with you as well to distract you.
Well, it sounds very different from my last experience. I can't say I'm looking forward to it, but if it's necessary, I suppose I'd better have the blood test.
Yes, your doctor does think it's necessary to be able to give you the correct diagnosis. Do I have your consent for me to take a blood sample now?
Yes, but can I have some of that cream first?
Sure. I'll get some now, and also call my colleague to sit with you.